So your dog is limping, and surgery is expensive, and rehab takes months. Then someone online tells you about a peptide called BPC157 that can supposedly heal tendons and ligaments and muscle and joint and even the gut. So, what's the truth here? Well, BPC157 stands for Body Protection Compound 157. It's a synthetic peptide that's made from a sequence originally identified in human gastric juice. It's become extremely popular in human biohacking circles and sports medicine because animal studies suggest it may accelerate healing of tendons, ligaments, muscles, wounds, and gastrointestinal tissue. Why are dog owners so interested? Because many of the conditions BPC 157 is claimed to help are things we struggle with in veterinary medicine: craniocruciate ligament injuries, tendon injuries, iliopsoas strains, biceps tenosynovitis, muscle tears, chronic wounds, gastric ulcers, osteoarthritis related soft tissue damage. So the promise is very simple: heal faster, hurt less, recover sooner. And that's a pretty attractive message for all of us. But what is the science actually showing us about the use of BPC 157 in dogs? And this is where things get pretty interesting. Most of the published data has been done in rats, not in dogs, but those studies have shown faster Achilles tendon healing, improved ligament healing, increased collagen organization and synthesis, improved biomechanical strength of healing tissues, an increase in blood vessel formation in those injured areas. In some of the animal models, the improvements were impressive enough that BPC 157 was stacked with another peptide and became known as the Wolverine peptide on the online communities. But here's the big problem: there are essentially no high quality clinical trials proving BPC 157 works in dogs with naturally occurring orthopedic disease. And that's the part that often gets left out of most social media posts. We have great rodent studies, we have benchtop laboratory research, we have pharmacokinetic studies showing how dogs process the drug after it's administered. But we don't have any large randomized clinical trials in pet dogs for specific conditions. There are no FDA approved veterinary indications, and there's no established canine dosing protocols. There's no long term safety studies that have been done in dogs. So there's a little bit of a problem here. Could it work? Absolutely, it could work. It could change how we treat so many of these conditions. There are biological plausible reasons that we may be using this peptide in the future. We can increase angiogenesis, which is new blood vessel formation. We can influence growth factor signaling. We can improve fibroblast activity, enhance collagen production, modulate inflammation. All of these processes are involved with tissue healing. The challenge is that plausible does not equal proven, and veterinary medicine is full of treatments that looked amazing in laboratory animals and unfortunately failed in clinical patients. What about safety? Well, this is another area where the evidence is very thin. The available animal data that we do have generally suggests a favorable safety profile, but long-term effects remain poorly understood. How long should we use it for? Is there a spillover point where the bad outweighs the good? One theoretical concern is that because BPC 157 may stimulate angiogenesis, some researchers have questioned whether it could affect tumor biology, although there, again, is currently no evidence proving that it causes cancer or makes cancer more aggressive. But the concern is still there. There's a sourcing problem potentially, and this may be the biggest veterinary concern. Most BPC 157 being used in dogs is obtained from compounding sources, from research peptide suppliers online, and other online vendors. So quality control can vary dramatically. When you're injecting something into a dog, purity matters a lot. And unlike FDA-approved veterinary medications, peptide products often lack rigorous manufacturing oversight, even when the online source of this is touting third-party testing and available certificate of analysis. So what am I telling my clients? I tell them this: BPC 157 is one of the most intriguing regenerative compounds being discussed right now. The evidence in dogs is nowhere near where many social media posts make it sound. So if your dog has a ligament tear injury, severe osteoarthritis, tendon injury, the therapies with the strong evidence still remain most appropriate. However, if a pet owner is willing to take the risks on their own, we'll help them try to source from a legitimate facility or manufacturer and try to come up with dosing that makes sense and a list of potential side effects that they could watch out for. So BPC 157 may find a home in veterinary medicine, and it could become a very important tool in sports medicine and rehab. It's just currently not supported by any strong clinical evidence in dogs, and that's a distinction every pet owner should really understand. Follow me for the next video on the next peptide that we're going to talk about using in dogs.